Welcome to our virtual town hall meeting again this week. As we had mentioned to you, we're doing this every 2 weeks and bringing you updates and having an opportunity to engage in conversation. In 2 weeks' time, so much happens in our community, from changes from state level, the governor's executive orders, to local changes. We know that this past weekend, a big local change for us. It was the beginning of move-in weekend for Colonel students, and they continue throughout this week. There's just always so much that's going on, and we want to be, as your community leaders, continue to come to you live and share information and answer questions as best we can. Our community continues to experience and deal with the burdens that this pandemic has put on us, especially to the people who are most vulnerable and the people who are most marginalized in our community. But we are paying careful attention to that as a county. People are feeling isolated. Before we got on talking about, some of the issues that folks are having from this isolation. And so we're asking all of us to take a little bit more responsibility. You've been hearing me say this repeatedly, and everybody else say it repeatedly, that we want to find that little extra bit of compassion for our neighbors, for our friends, and we ask people to do the same for us. I know without some of the folks in my life, I will not be holding up as well as I'm holding up. So I'm thankful for the people who make the phone call or who just shoots me a message on Messenger, Facebook Messenger or email, just to check in. Today we are joined by, let's see who's all here, Kate Shanks Booth, who is the Director of Youth Services for Tompkins County, our Youth Services Department, and Lisa Monroe, who is the Director and Department Head at Tompkins County Office for the Aged. Welcome to two new faces to join us. And so I started with you, and our old heads returning, Frank Krupa, our Public Health Director, who's here with us and who's been the man holding it down throughout this county. And everything COVID related, heavy lifting that Frank has been doing, and our County Administrator, Jason Molina, who's also been working 24/7 with members of the EOC and Frank and community partners for all of us to stay as safe as we've been staying and continue to try to keep this virus under control in our community. And in the background, who you probably don't see, is Dominic Recchio, who's our communications manager, director for the county, and others. So thank you very much for joining us. Our community has a very strong history of coming together and addressing community needs. Often when things are going awry, and we have been, over a number of years, coming together and contributing towards a collective impact initiative or model for trying to meet some of those needs. We pull together minds and resources from across both public and private sector. We've seen this as we've been doing it with this pandemic. It's not just county government. It's local partners from CMC to Cornell University to you, the community member, department heads, agency leaders, who are all coming together to help us deal with this. Rather than, all of us working individually, we wouldn't get anywhere if we just work individually in our own little silos. We've been doing this together. Somebody who's been very a leader in bringing the collective impact initiative to Tompkins County. We just lost this past weekend, and I want to acknowledge him. I want to definitely take this moment to acknowledge a champion of collective impact, Kirby Edmonds. Kirby left this world on August 20th, and is going to be a big loss to this community. Kirby was a dear friend of mine. We worked on several things together. Um, I met Kirby so many years ago when we both became uh, mediators, volunteer mediators for the Community Dispute Resolution Center. I was fairly new to the community, and he's one of the people who welcomed me. And we've been doing it ever since, not just here locally, but we travel to other places and provide mediation services and trainings. We both became trainers. Harvey was instrumental in getting building bridges together and bringing agencies and organization and minds together. He was really deeply caring and took a strong stance on educating, training, and holding people accountable on issues related to racism, issues related to diversity, equity, and inclusion. As a founding partner of Training for Change, we've done a lot of work with him at the county, and I know there are innumerable agencies in this community and beyond who can speak to his work with them. So for all of us in this community, it will be a tremendous loss to not have Kirby around. And I do want to, as you're joining us today, those of you who are joining us via YouTube and those of you who are here with me on this panel, to just take a moment um, of silence just to reflect on Kirby, his work, and if he's had any impact on your life you may not have even known that he has. I'm sure that there's something that he did that touched you. So if you'll just join me in and indulge me in a brief moment of silence in honor and respect of Kirby and the work that he's done. Thank you. Thank you very much. Rest in power, Kirby. Rest in power. Those of us who are left will continue to honor your name with the work that we do. And in that vein, I do want to acknowledge one of the good things that Tompkins County has done in that vein, and that was hiring a brand new, first time Chief Equity and Diversity Officer. This is someone who will come into our community and continue some of that work that Kirby has started and has made his mark doing here in Tompkins County. So kudos to Tompkins County. I'm using big words like kudos. Ordinarily, I'd say big ups to Tompkins County for taking that step, especially at a time like now. I show the panel today that I'm wearing my Good Trouble t-shirt. You can't see it. Because we continue to deal with issues of violence against unarmed Black people and murder of unarmed Black people in this country, Black and brown folks. We just have that happen again, not only at the hands of law enforcement, but primarily at the hands of law enforcement, but elsewhere. The chokehold is real. It is real. And I don't just mean the actual physical chokehold, I mean the chokehold of racism and bigotry. It is real and continues. And so we all need to take a book out of Kirby's page, a book out of Representative John Lewis's page, and it's time to stand up and get into some good trouble for change. We have to be those change agents. So thank you all for letting me rant for a minute on that because it is extremely important. This week also, Frank Krupa, who's on the call here with us, shared with the community a letter in which he called for us to broaden the concept of public health. I found that letter to be really, really enlightening. Our public health response has been it has to be wider than just stopping and treating COVID-19. You know, Frank talked about some of what I just spoke about, which is being responsible to care for our neighbors and commit to doing more in service to one another. While there's no doubt that COVID-19 has brought an even sharper focus on the inequities in our community, and we know that we've seen those disproportionate numbers of who's affected, it's also given us an opportunity to roll up our sleeves and truly reimagine how we as a community want to rebuild and even course want to correct in ways we serve the most vulnerable in our community. Those were things that Frank stated in his letter to the community. And Frank, I really appreciated that because people just look at, oh, I have to protect myself from COVID-19. I don't want to get it, you know, but it's more than that. We have to look at public health, as you said, as wider, as broader than that. You know, our response to COVID requires us to look to what traditionally, to think beyond what's traditionally health, you know, whether or not you're sick, ways to avoid getting sick, and also respond to the need for food, which we've been doing, healthy food in our community. Um, Healthy food should not be so expensive that our most vulnerable populations can't afford it. So when we think of health, we have to think about food insecurity, and healthy food availability and accessibility. We have to think about housing. How many of our friends and neighbors and community members are homeless and don't need to be when we have housing available, or those who are living in substandard housing because that's all they can afford, or have to bunk up and bring strangers into their home to share the rent. We have to think about that. That's part of our public health. And it takes a toll on our emotional well-being, all of those things, whether we're experiencing them or we're on the outside looking at somebody who's experiencing them. It does take a toll on us. And so we all need to take care of our emotional well-being as well. We all have responsibilities, as I stated earlier, to care for our neighbors, not just for ourselves, but for our neighbors. This is one of the ways that we expand and broaden the vision of public health. I'm going to stop talking, and and I'm sure that there's probably more that Frank can share just on that letter and what motivated him to bring that out. So Frank, I wanted to invite you to share some more in your recent message, and what type of work we should all be engaging in moving forward to meet these needs and to help others.
Thank you, Les, and you said that very, very well. First, there's a team of folks that help me always, and they help me with the ideas and the thoughts, and this letter is no different, and those folks know who they are, and I just want to thank them for supporting me and the work that we're trying to do. The idea of prevention is core to public health. So even in COVID, as we've been talking about it for 6+ months now, the whole purpose is to prevent the spread, right? Obviously, we're caring for the sick. That's extremely important, and that work is being done. But really, from a public health perspective, it's about preventing. It's about preventing additional unnecessary exposures that could cause other people to get sick. And so when we talk about public health, it's broader than just going to the doctor or accessing care at the hospital, the traditional things that we're used to. It's about, as you described, making sure everyone can be healthy and safe. And everything touches on that. Everything from having a safe place to lay your head at night, to having nutritious food available to you, to building up our community so we don't have folks in low socioeconomic status that don't have access to care or services that they might need. All of those things were important pre-COVID. You can go to the health department website and see our community health assessment or CHA, or a community health improvement plan, or CHIP, that were designed to help us understand the health of our community and set a course forward on how we might address those things. Those were challenging goals pre-COVID, and they've only become more magnified with COVID, right? So as we've asked for dramatic response from our community around COVID, to follow the guidance, wearing masks, staying home. It's exasperated the challenges that we were already facing. And so, the main purpose of my letter was to just let our community know that we haven't lost sight of those issues. We know that they're still there, and we know for many people they might even be worse now that COVID is added on top, and has created new challenges. But we have an amazing team at the county. Lisa and Kate are a part of that, but they're all of my colleagues as department heads and the folks that work with them and on their teams. They're doing this work every day to try to address the human service needs of the people in our community. And so as we move forward, obviously we have to keep focus on COVID. We need to make sure we keep the disease at bay, and we follow the guidance and limit exposures as much as we can. But at the same time, we have to be just as vigilant with these other public health issues that range across the age spectrum. Kate works with our youth. They have distinct needs. Lisa works with our aging population, and everyone in between. All have different needs, but as a community, we have the potential and the opportunity to focus with the same effort and vigilance on these other public health issues, while we're still making sure that we're doing things the right way for COVID, to prevent the spread there as well. So I appreciate the opportunity to talk here today. I'm super excited to have Lisa and Kate join us, because they are the experts in their fields and can help us kind of guide our community forward as we try to address these issues.
Thank you so very much, Frank. Really well put on how all-encompassing all of this is. So thank you for that. Earlier we did mention, and thank you for mentioning again, Kate and Lisa. Glad that you all can be here, and we'll give you an opportunity to expand a little bit more in introducing yourselves to those who are watching us, who are joining us, with a brief explanation of the services that your department provides, and how people in our community can seek and access your services. I know that the thunder and lightning and everything else has started out there, so we might see people going in and out. The lighting is bad. Things are happening.
Yes.
Yeah, we just lost power. I was just talking about it. And you might she disappeared, and she just lost power. So please bear with us. Go ahead, Lisa. Then you're in the spotlight.
Well, I guess I had to turn the lights on. Usually it's pretty bright in here, and sorry if I'm jumping because it's getting loud out there. Yeah, I just wanted to say thank you all for having me, and also that to thank all of you for all the work that you've done. It's just, you've all done an incredible job, and I couldn't be more proud to be part of this team. So thank you all. And I also want to express my condolences for Kirby. The Office for Aging has sought his counsel and guidance over the years on many issues and projects, and he really will be sorely missed in the community. But as far as the Office for Aging, really, our mission is to assist older adults and people with long-term care needs to live independently in their homes and communities with quality of life and dignity. So our office really serves as a general hub of information, a no wrong door, if you will, to resources, referrals, assistance, and to provide options to people as they're navigating through many difficult life decisions and as their needs arise as they're aging. Yeah.
All right. Thank you very much. And again, I'm glad you can join us.
Yeah, thanks.
Jason, why don't I jump to you and have you talk a little bit about the county as a whole, anything that's going on, and then I'll let you take over moderating from this point. Is that
Sure.
okay?
Thank you, Leslie. Thank you so much, and thanks for the great introduction. Appreciate all your comments and thoughts. And I'll keep it brief because I think we've got some good questions, and people want to hear from the folks with us. I'll also say, Leslie, that as I ask these questions, I'm going to look to you to wear two hats. One at GIAC as the GIAC director, as well as the chair of the legislature, because I think you have some unique perspectives in both those roles, if that's all right with you.
I'll do my best.
So in general, Frank talked a lot about about the team that we have at the county. And one thing that's really been impressive from my perspective in seeing and working with all the department heads is the amazing flexibility and adaptability that team has played over the past 6 months. The ability to deliver services in a way that would have normally, if you had told us we had to do it this way, we would have taken probably months to plan out, and just didn't have that time due to the public health risk. And their ability to change their approach, their ability to try to meet people where they are, whether it's through telemedicine in our mental health department, whether it's through social services trying to connect with clients, whether it's our child protective services, folks going in the field, but also trying to find different ways to approach and still reach out to families in the field. All of it has taken an amazing amount of adaptation and flexibility by the department heads, but by the staff that are in the field doing the work. And I can't say enough that if we talked about every department, we could go through a laundry list of ways they have changed and adapted to ensure that their clients and their customer and the people they serve are still served in the best way possible. And they've really tried to take the approach of no one's getting left behind through this process. Challenging, but nonetheless, they're committed to ensuring that our constituents get the services they deserve. So I think it's kind of just a broad perspective of things from an overview from my perspective and what I get to see. Obviously I work with all of the department heads and their partners, their community partners have been phenomenal in supporting this effort and trying to meet people where they are and adapting to the world that we're in right now. So that's kind of just my general comment of what I see in the county as a whole. The partnerships that we've been able to develop, whether it's with our community partners addressing a food issue, whether it's our community partners and working with our homeless population to ensuring they have the care that they need, or whether it's with our partners at higher ed. I've said before that we probably never had a better relationship with our higher ed. It only took a global pandemic to get there. But our ability to communicate with them and their ability to communicate has never been better. And I think that is a testament to the perseverance of the community and their willingness to cooperate and work collectively. So I have nothing but compliments to the community for all of our partners and our staff and the community members that we've been able to work with. That said, what do you say we get into some questions? Hopefully Kate will be able to join us. I think she ran out of power where she was at, but hopefully be able to join us. So I'm gonna, there she is. We'll see if she can get online. And then if you'd like, Leslie, I can have Kate. Welcome back.
It's all about the drama. How's everybody doing? My
Always
apologies.
like to make, there you go. There's a way to make an entrance. I like it.
I try.
Hey, why don't you briefly just talk about youth services and the mission of youth services, and then we'll get into some questions.
Yeah, sure. So I have the best job in the county. I get to work with some of the coolest people. We cover 0 to 24 years of age. So we like to say that we're the backbone of youth services. And a lot of times when people think youth services, they get us confused with our partner, the Ithaca Youth Bureau. We're not the Ithaca Youth Bureau. They do awesome work. We do things a little bit different. We're a funder, so our funding comes through us, and we fund programs at the Youth Bureau, Family and Children's Services Open Doors, the Learning Web, and then also the Teen Parenting Program at the Daycare Council. So then we get to be advocates. We also work with the Rural Youth Service Program, which is through CCE and local youth commissions or community councils at different municipalities to help address the special needs for the rural youth that live in those areas. And then on top of training and doing other things. So we have our hands in a little bit of everything.
Great. Thank you, Kate. So let's start off with some questions. And most of these questions go out to everyone, so I'll try to preface it. But Frank, before we get into things, maybe you can give us a brief overview of the prevalence of COVID-19 in the community. Lately we've had a few cases, but yet thousands of people are returning to our community, which we're happy to see. Can you kind of give us the Cliff Note versions of what's going on right now with COVID-19?
Yeah, absolutely, Jason. It's been really good from a disease front for the last couple of weeks. We've had a couple of cases, every day, 1 or 2, a couple of days with no cases. So the disease prevalence is still really, really low. And Jason, as you alluded to, we've had thousands of people returning to our community with the reactivation of campuses here. And there's so much testing happening as those folks return. To have this few cases identified is amazing. And I'm so very happy that this is what we've seen so far. We're obviously not done or out of the woods yet. There's still more folks set to return, and then we have to, keep pushing through the fall and make sure that we continue to modify our behaviors so we don't have additional spread. But so far so good on the disease front, and let's all hope that it continues that path and we stay the good course.
Great. Thanks for that update, Frank. Appreciate it. And kudos to our public health nurses, community health systems for all their efforts in managing health disease. So the next question what I'd like is maybe all four of you to kind of give me two specific points and briefly, where have you seen increased need as a result of the pandemic in your area of expertise? And maybe Leslie, you can talk about a little bit from your hat from GAC, if that's something you're willing to do. Maybe I'll have you go first, Leslie.
I'm trying to, like, my light seems to be doing some strange things. So, I can see myself, then I can't see me anymore. So bear with me. Okay. So one of the things, from our end is, as we know, the pandemic, people went out of work. Lots of people furloughed or laid off, employment, opportunities, few. And what we have found is that there are more caregivers who are now returning to work, even taking up, extra jobs. And what they need is a place for their children. So childcare is one of the biggest needs I'm seeing, from our end for this pandemic has really highlighted. And then with schools postponing reopening, in-person reopening for a number of parents who were sending their children back to school, because even for those who are able to work remotely, it still creates some difficulties for them. And so they were willing to, have their children go back to school so they have that opportunity to work. So the childcare piece of it is a huge need. The second part of it that I would say that we're seeing is with the unemployment, enhanced unemployment ending, with some people perhaps not being able to continue on unemployment, that there is an increased need for what we here at GIAC deal with, more general support for household things, people who need to move and looking for security deposit help. Some people are getting the rent relief assistance, but there are others who are still in major arrears who need help. So those are the things we're seeing. Now we're helping with.
Child care has been a constant issue that I know we've faced from day one. That's good points. Lisa, how about in your realm? What are you seeing, perhaps two of the increased needs from the pandemic in your constituency?
Yeah, it's shifted a little bit, because initially in the beginning, we're really fielding calls from people to just ensure their basic needs. I mean, essential personal items, food, medicine, things like that they really were in need of, or emergency heating assistance or things like that. It's kind of leveled back off to where people are calling about some of the things that they normally would, like our health insurance counseling. But people have also identified they've been alone, and they're in need of different things that they may not have accepted before, like personal emergency response buttons or things like that. But lately, we've really started to see increased calls from caregivers, questioning in-home help and housing options. People are calling to, move their loved one to town so they can be more involved in their care, or how they can access their care or their parent or loved one if they're not local, and what should they do, things like that. So, caregiving has been difficult through this too, as far as elder caregiving.
Gotcha. Thank you. Kate, what have you seen in terms of one or two increased needs as a result of the pandemic with younger folks?
Yeah, so just to piggyback on what Leslyn said, that need for childcare is a real big concern. And then wrapping around services for those kids that are going to be doing partial in school and out of school or all online. And then the piece too that we begin to think about is that physical and emotional health of those kids, right? When they do come back as providers, how can we be ready for that, and have those conversations, and make the kids, and not just the kids, but also the parents, feel safe, returning to that normal. And so there's been a lot of that happening throughout the pandemic. We have a lot of really exciting stories of people who have been through it all and haven't shut their doors. So just trying to get that message out to those parents as we're trying to figure out how to get that positive campaign that, it's okay to step outside a little bit.
Good. It's a good point. I think I might want to come back. I'm going to come back to for you and Leslie to talk a little bit about schools and children in a second. But Frank, can you answer this question in terms of increased needs, wearing your mental health commissioner hat on, and just talk to us a little bit about what you may see increased needs, and has that shifted over the pandemic? And if give a little insight from the mental health perspective.
Yeah, one of our biggest challenge was to transition to a more virtual way of providing services, either over the phone or with video conferencing. For some folks, that's been a godsend. We've had better participation, more engagement. It really has worked for them. We found a new mode that really, engages them. But for others, it's created a barrier. And so we have to navigate that. And one of the groups that the biggest barrier exists with is children. We have therapists that provide services in our local school districts, and they've been unable to do that. And as you can imagine, particularly for the younger age group, trying to engage them in therapeutic services over video or over the phone is challenging, right? So we've been engaging with the families and supporting them through this, but we've got work to do to figure out how we're going to engage with our youth in our community around mental health services.
Thanks, Frank. And to carry that theme across with our youth, this is going to be a question directed to Kate and to Leslyn. Some of the schools are making decisions to do online instruction. Some are offering both options. Some right now prolonged in person for a temporary period of time with an unknown certainty if online is going to continue for the semester. Maybe you can just give us a quick snippet, a quick shot of what discussions you're having with districts, parents, or other partners to help meet the needs of our youth. Maybe Kate, why don't you go first, and then Leslyn, I'll have you follow up with it.
Yeah, thanks, Jason. That's a good question. I think it depends on the school district that you're dealing with, right? We've had several conversations. If you look at some of the plans that they have put up online, some of them have thought about that, and they've reached out. And so I know in Trumansburg, there's a partnership between the Rural Youth Service Program, the REC program, and the school to specifically focus on 7th and 8th graders up there, and they're going to use the fairgrounds. There are some programs that it's just sort of ongoing. There is GIAC has got some stuff going on. I think more than anything, it's sort of a moving target. And so providers are sort of trying to create all the options available to wrap around those services, provide maybe some of those longer term, maybe a 9 to 4, doing tutoring programs is what they're looking at more. Things in that realm. So not just childcare, but development and enrichment for those kids too. So it just depends on which district you're in, but I continue to be impressed with the creativity and the passion and commitment and the flexibility of our childcare providers and our youth development specialists in our county.
Thank you, Kate. Leslyn,
yep.
Can you add into that in terms of what discussions you might be having with districts and parents and other partners to meet the needs of our youth?
So everything that Kate said, and then, one of the things that we've gotten even more engaged in is thinking about children who remote learning really does not work for them. So we've been engaging in that conversation on how do we work with the district to provide a safe space that, although they might still be engaging with their teachers or their classrooms remotely, they still have connection with human to help them navigate those systems, to help them. Frank is having the same issues I'm having, to help them, stay focused. So we're having those conversations because here at GIAC, we had to pivot as well in what we're doing, not childcare, but academic support that works for the individual student. And we're going to be doing some of that.
Yeah, I can attest as a parent of three school age children. What works for one does not work for others, and you've got to really meet them where they are in order to get the best out of it. It's a difficult balance, and school districts have a very difficult job. Superintendents are really working hard around the clock with their staff to try to make this the best experience they can. And I know, Frank, you meet with them regularly, so my hat goes off to all of them. Let's shift it a little bit, and I think this kind of goes to a little bit of what you said earlier, Lisa. Maybe you can start this question off, but I'd like to hear from everyone. There's been a lot of isolating time for people in the community, right? We've been isolating ourselves, quarantining ourselves. Remember, Frank, isolation is for the sick, quarantining is for the healthy. But either way, it's alone time where we've been separated from families, the people that we care about, but also from services. You all describe your departments as being almost an information hub or the ability to distribute services or resources. So what do you do to reduce the isolation of people that you serve, and how have you been able to overcome some of those literally physical barriers? And maybe Lisa, maybe you can talk a little bit about on your end of things from older adults and kind of give us a little understanding of what you're doing on your end.
Yeah, it's been difficult as everything moves to a virtual platform. That's not always something that older adults are using, and we're trying to transition that a little bit more. And in a time where everything is virtual and there is no in-person opportunities, it's pretty hard. We have been providing like telephone reassurance to our clients, our home delivered meal clients. We have a project care program that is a friendly visiting program, typically in person. Now that's all transitioned to calling their visitors, so they're able to do that. The State Office for Aging is partnered with Ageless Innovations. It's like a robotic pet. I think, Jason, you've seen them in
Yes.
Yes.
A robotic dog, yeah.
I have a cat right here. Yes. So it was piloted in 12 counties the state piloted it, and it really showed some positive results using a loneliness scale. And so we were sent some additional pets through the pandemic. NYSOFA sent them to us, and we were able to get those out to clients. Currently, we're working on a technology tablet project for clients who would be income eligible and meet some specific criteria to provide them a simplified tablet with LTE and a support hotline, and matching them up with the students from Ithaca College Gerontology Institute. So to help them kind of navigate through, because we found out quickly that some people, there's one thing about people not being able to use technology, and then there's people that can't even afford the technology. So that's even a further gap. So it's just kind of a layered issue. So we're trying to work on some things to get through that and break through those barriers a little bit more.
Frank, I want to circle around to you on this question more from a public health perspective. You have some programs in the public health department specifically for moms. How do you get past this isolation barrier, particularly in programs like WIC and some other programs? How have you worked around that?
Yeah, the flexibility to be able to do things virtually has really helped. And our WIC, Women, Infants, and Children's program, from the start went virtual immediately with phone and video. And similar to as I described with mental health, for some folks, it's increased engagement because it took away all of the barriers that made it difficult for them to come to us for an appointment. But then for others, you're right, it is a barrier. And so we've been making regular phone calls to our clients, and that's mental health, public health, just to let them know that we're still there for them, and trying to engage them with the opportunities that we have, and talking to them about if these aren't working, what might, and how do we get to a place where we can still support you. We're not all the way there yet, but we are definitely trying to make those connections wherever we can.
I think it seems to be common with everyone in all your different areas that the remote element of things works for some and some situations, but it's definitely not a solve all. And trying to find the solution for where it's not, it can be different for everybody in every group. I guess I want to shift just a little bit. So whether it's working with older adults, whether it's working with youth, whether it's the public health, mental health realms, all four of you work intricately with other community partners, right? You don't work in a box. So maybe if you could pick one community partner that you work with, your department works with closely, can you maybe share just with our viewers and our community, what is that community partner doing that you think the community should be aware of? What have they done to really make themselves unique, or that's something that you think the community should be aware of in a service that they're providing? And maybe, Lisa, I'll start with you. Then I'll go to Leslie, Kate, and Frank.
And I picked two, Jason.
All right, Lisa, two.
Okay, all right. So I have to shout out FoodNet, because FoodNet Meals on Wheels is one of our biggest subcontractors, and they've really done just amazing work through this pandemic by keeping going. They've been serving about 18% more meals as compared to 2019 during the pandemic. So that it was really an increased production on top of it. So they've been doing a great job, and they also had some funding from United Way that they were able to distribute additional 8,750 additional meals to people during the height of the pandemic. So that was great. And the other one I'm going to talk about is Lifelong, and I'm choosing that because it kind of goes along with the social isolation piece that we were just talking about. And Lifelong really they had to close down during the pandemic, and they're a nonprofit, and they were, had to furlough their staff. So, we've worked a lot through this to try to, help them be in a place where they can be prepared moving forward. And they're working right now on a soft opening, putting everything in place, measurements for welcoming some on in-person groups, but they've also switched to some virtual platforms. So that's been great. They have an exercise class that's being offered 6 days a week virtually. They're going to have their first outdoor class also. Their fall catalog is done, is ready to go. A lot of the classes are Zoom. So they're really working on trying to meet the need that kind of was there without anything being offered. So
great.
Help them out too.
Good two examples. Leslie, what about you? Community partners that you think the community should be aware of?
Man, so like Lisa, there isn't one I can. At GIAC, I will say this entire community has been our partner.
Sure.
I mean, there is no secret it's being out there. Without this community coming through with in-kind support, financial support, we would not have been able to do the things we've been doing this summer and going into the fall. So this, I would say the entire community, everybody from Office of the Aging to Youth Services, and Kate with TCAT trying to get the bus to run this way so that folks can get to the pool, to monies, Purity coming through with monies for us, and private donors, the United Way of Tompkins County, huge partner. I can't pick one because it's been such a collective. Speak of collective impact, it really has been such a collective of agencies and individuals that's really helping us to do. The school district, just all of them. Cornell University coming down and partnering with us for a food pantry to meet the needs of those people who had food, insecurity issues, just everyone. So I'm sorry, I can't pick one. It's been really a collaborative effort.
All right, I'll give you. Kate, can be one community partner, Kate, that you want the community to know about.
I'm sorry, Jason, I'm going to have to do two.
You guys are horrible.
Two, I know. It is like everyone, Leslie, that's hard, right? Everyone, thank you. But a couple ones, I really need to give a shout out to Shelley Lester and the Rural Youth Service providers at CCE. They really have stuck to this online, getting out there, connecting with people, especially those kids who are rural, right? And so they don't have the transportation and they may be marginalized, low income, all of those things that provide barriers to getting those resources on any regular time. And so they really have reached out, phone calls, surveys, and provided programming that interested the kids. And then they did this really cool thing where they did a hybrid. So everybody in the county, all the kids were able to do online. They were able to learn about a topic. It may have been photography or it may have been hiking. And then individually, they were able to go in small groups and physically go with their parole youth manager and actually work on that project together. And it was just really cool to listen to them light up and talk about how excited these kids were to just be in each other's presence and doing cool stuff. So, kudos to them. That's awesome. And the other one of the things that we do here in these services is we're the CSEC coordinator, which is the commercial sexual exploitation of children. And there's been an uptick in social media of people talking about this. And so my deputy director, Bridget Nugent, is the coordinator. There's a critical team that she works with, and we partner with the Advocacy Center here. They do a wonderful job. And so using technology, one of the things that they've done is created a podcast called Let's Talk About It. And so we put that on our website, and I sent Dominic the link earlier to that. But they talked about what is sex trafficking, who is at risk for it, how to maybe spot it. And it was just a really innovative way to reach out and reach a community and a target that might not have have had the opportunity to talk about that. So those are my two examples.
Thank you, Kate.
Sure.
Frank, you only get one, even though you have 2 departments. That doesn't equal 4.
I should get extra.
I know your math, Frank. I know how you do math.
Yeah, I'm bad at it. So I'm going to give you 2, but for the same reason.
All right.
Obviously, like everyone else, all of our community partners have been awesome, and none of them closed right through all of this. Every one of them continued to serve people in one way or another because they're vital. I want to call out CARS, the CAG Addiction Recovery Services, and the Alcohol and Drug Council of Tompkins County. We know that substance use disorder didn't take a break during COVID, and they continued to operate. As folks are probably aware, much of those services and treatments are based on group talk or individual talk, and so that's difficult to do. And that human connection in helping navigate what is a significant disease. And both organizations, they came forward immediately. They moved to virtual initially, and they have gradually been reopening for more face-to-face, in-person type services where it makes sense and in a safe manner. And yeah, I couldn't be prouder to have them be part of our community and the things that they've been able to do to help folks that are struggling with substance use disorders.
Great. Thank you, Frank. Good points. I have one partner that I'll make a note to, although there are many others. One I just want to speak to is our school districts. The school districts, interesting, have done, I think, an unbelievable job of trying to reimagine how they're going to create safe spaces and get students learning again. As you know, every school district has to have a certain amount of public meetings. I happen to live in the Trumansburg School District, but when I came home one night, my wife said to me after one of the meetings with the superintendent, she said, "I thought you had a tough job, Jason, but they really have a tough job." Just kudos to them and the work they've done. Also want to make note that over the summer, the hundreds of thousands of meals that they delivered to people throughout the community, and just not to families, just not to students, to families of students, to neighbors of students. Really remarkable job, and my hat goes off to them and the tough job they have getting students to back in-person learning again, which I think is critical. So that's good. I appreciate everyone's insight to that. Lisa, this is one for you, and it's come in a few times. How do you connect with senior living facilities and nursing homes when you can't go in them and the visitations are still very, very restricted? How are you connecting with them? You're on mute. But what you're saying is profound.
Can you hear me now? So
Word of the pandemic, profound.
Right? I learned that from Les.
oh, thank you. So I just have to say thanks to Frank too, because really he coordinated weekly calls with the facilities for quite some time. I don't know how long they lasted, but I think that was a really important collaboration and partnership that we had there together. I was able to join them on those calls, and I could, gain more understanding of what issues they were facing. So I appreciated Frank for doing that. But other than that, we run the long-term care ombudsman program for, it's really a regional program. and it's run through the State Office for Aging, but an ombudsman, just to let people know if they don't know what it is basically an advocate for people that live in long-term care facilities, nursing homes, assisted livings, and small in-home care facilities. But we do run the one there's 15 regions across the state. We're one of the 15 and ours is for Tompkins, Schuyler, and Chemung County. So we oversee all of those, not just Tompkins County. And at this point, we really are not doing in-person visits, although the governor, lifted the restriction on visitation. The guidance from the state is we're still waiting on that to resume visits because this is a regional program and we're responsible for 1,900 different residents across 3 counties. They really want to put some consistent guidelines out there to, for visitation and things like that. But since the beginning of the pandemic, our staff has reached out to all the facilities that we're responsible for, provided pamphlets and materials so people know we still existed, and but there's a dedicated hotline number that people can call and that we've been responding to the whole time for families or the residents there in the facilities.
Question we've had a lot about how they can visit loved ones and how they can connect to them. And I know some places have allowed folks to see each other through a barrier, through a plexiglass, but that just isn't the same approach. So I appreciate it. And there are many folks in our senior living facilities, nursing homes that don't have family close to interact.
Absolutely.
Frank, I'm going to go to you on this one question. People are having, I think it's natural to say that there is, it's appropriate to acknowledge that there's hesitation to returning back to normal, right? There's anxiety over this. And I think this would be important for everyone to answer, but I want to start with Frank. If you're to talk to the community, what are some things they should keep in mind when they're thinking about going back to what the normal is, both from a physical, mental, or emotional health perspective?
Yeah, I think the most important thing we have to recognize is that COVID's going to be with us for a little while longer. And so we've got to figure out how to re-engage, reactivate our communities safely, knowing that COVID is still out there. And you're right. I think it's okay to be hesitant and be fearful, right? If that's, how folks are, it's okay to have those emotions. But what we need to know is each of us taking personal responsibility, doing the basic things we've been asking, staying out of large groups, wearing your masks, 6 feet of separation, good hygiene, and then working with, whether it's your employer or a business that you frequent, wherever it is that you might go, understand that they're trying to make it as safe an environment for you and them as possible as well. Be patient with each other. Accept guidance. If somebody asks you to do something because of COVID, if you can do it, right? I mean, that's it, they're doing it because they want to be safe. They want you to be safe. And so we do have to figure out how to re-engage because we can't stay home forever, right? There was a few months ago where I was imploring everyone to just stay home. We're at a point now where we're transitioning, and it is okay to go out. Please follow the guidance, take those simple steps, and engage with the people that you're interacting with in a way that's safe for you and them as we move forward.
Thanks, Frank. We have another question here, and Leslie, I think I want to throw this back to you to close this up, but I think this is a good question for you. If someone wants to contribute to the community, where can they lend their support?
Jason, that's a very good question. And I hate to generalize, but it is almost to say everywhere. I would encourage people to call that 211 number. I would encourage them to call the various agencies and departments like Office for the Aging if people are looking to lend support. Some people want to support help with shopping for seniors, or just call 211. I think it's a great place to start if you want to lend support, whether it's financial support, whether it's, that sort of active activity support, to call that number. Other places to call, United Way is a good partner. I mentioned them earlier as a place to call, to see where can I help out, where can I? And I know that online, on Facebook, there's Mutual Aid Tompkins that a lot of people would put requests in onto, and people will also offer support. That's where GIEC, we got some of the support we were looking for, for folks with expertise. So I would encourage people that those are some places to look at.
Great. Leslie, I think we've gotten to the questions that we've had, so I'm going to turn it back over to you.
So I want to emphasize what Frank said, just in terms of the things that people have to do. I have been hearing, the more we work with young people, I've been hearing, especially the teenage populations, who are saying, COVID doesn't bother, it doesn't hit us. We're not the ones dying. And so, we don't have to wear the mask, or we don't have to distance, all of those things. And I think what they do, we need to do a little bit of increased education to that particular population, because I think they don't realize that, yes, you may not be the one getting sick, but you might transmit that to someone else, your grandma, your grandfather, even your parent, or someone else who, is immunocompromised, and that person could get sick. So you may be asymptomatic and you're just fine because you're a teenager and you feel that it doesn't, affect you. So that's a population I think we really need to focus on, some education around the importance of following all of the guidelines that Frank mentioned. As a community, I really want to encourage people to call the numbers we mentioned and check in the places we mentioned earlier. It is so important that we all work together on this. We have seen, as you said, Jason, the school districts step up in ways that they have never had to do before. The county, the city, all their departments, and the individuals in their community really stepping up. We have done creative things here at GIEC. Like we had a virtual graduation for our peewees or kindergartners and pre-Kers, and we sent cake mixes home to all of them so they can make their own graduation cake, and they all have their own motor boards, and then we had a virtual graduation. Everybody get to show off their cake. We have to be creative. We have to think of other ways of engaging, easing the isolation, and getting people involved again in ways that are safe. So I do want to thank everybody. I thank all of you on this panel for all the work you've been doing in reimagining public health. That is so important. It's more than I'm not sick. It's bigger than that. It's social justice. It's minimizing the inequities or eliminating them if we can. It is getting past our silos and working together, checking on our neighbors, is going out of our way to do things that we have not done before, being a little uncomfortable, calling up that senior and having a conversation just to check in. So I thank all of you for all of it. I thank the community for watching. Continue to bring support if you have the ability to do it. I think every human services agency out here will be looking for financial support. If you have the ability to, please reach out to them and offer support so that they can keep providing for particularly the most vulnerable and most marginalized in our community. Thank you all very much.
Thank you. Thanks, Leslie.